Hello, doctors. I'm Dr. Kim Jabrowski in Orange County, California. EHRiX asked me to take just a few moments of your time to share with you something that I'm very excited about. It's called the Electronic Health Records Information Exchange, EHRiX. One area that I'm really anxious to get to right away is actually the physician's view. So if all you have to do from the panel at the top is click on Physician View, and you're going to be able to see exactly on the left there what you're going to need for the examination as an example. So if you can click on you have the patient chart, the examination, the special forms. There's a whole array of things that you can look at. Let's click on the examination first and show you what that looks like. We all understand that in this environment of insurance audits and even government audits with Medicare, making sure that our notes are up to par. It's very important for us to be able to not only record accurately what we're doing for the patient, because if we didn't record it, we never did it, but also we need to be able to work quickly. This system was designed for speed. It was designed to go fast. In fact, one gynecologist in Bakersfield, California that's been using our system sees right at 50 patients every 2 hours, and this hasn't slowed him down one iota. So on the forms that we talked about, every form that we're going to show you is going to be a form that you use right now, doctor, in your office. This is the form that I happen to have, but whatever forms you're using right now, EHRiX will customize for you, no matter what they look like. Here's some forms here set up for some in the gynecology area, but whatever the form is that you want to see, that's what we're going to set up for you in your practice. So that makes it perfect. There's no reason for you to have to change, what you're doing from day to day, and EHRiX again makes that very, very easy. This is just one of the forms that is rather detailed, but that EHRiX customized, and you can just see all the different areas here in the complete roster of areas that we're able to check there. One thing that's very important also is that, we probably won't show you now, but you can create your own templates. So you can already have the areas that are populated. So with a couple clicks, you've already taken your forms and you have everything filled in. And then you can come back from day to day or from patient to patient, examination to examination, and create the details. Here at the top are vitals that probably you can see at the bottom there, by the way, I've already populated very quickly with the diagnoses codes and different objective summaries in this case. But if you scroll back up to the top, you're going to, or let me click real quick here on, I'll go back, let me go at the top first, and I'll show you there's different vitals areas. If you put like pounds as an example, or 200 pounds, it's going to calibrate in kilograms. If you put 6 feet, or your front office puts 6 feet for height, it'll turn it into centimeters. And we even have a BMI calibration as well. That's really, really neat. And on the chief complaint, we won't, again, go into all the detail of typing in, but you can put in like headache as an example, or back pain, or whatever the particular chief complaint is that you're dealing with. And anyway, you can go through that very, very quickly. We have a clinical summary on the bottom left I want to point out to you very quickly. This is something that the new government guidelines, when we got certified, or the company got certified, they had to come up with. And when you see a lot of patients a day, whether they're 10 patients, 50 patients every couple hours like the gynecologist, or 50 patients in a week, a lot of times you aren't going to remember very much from one patient to the next, especially if you haven't seen a patient for 6 months or a year. The clinical summary gives you at a glance all the vital information on that particular patient. So you can see everything basically there that you need to know, even the medication and allergy list. So it's a slick thing, and it's only at a click. And just like a cheat sheet you would use for anything that you're doing, this brings you up to date in an instant of what's going on with that particular patient. I think now is a good time to also tell you that with EHRiX, you get a complete medical library. You have a complete patient education resource section, and you have all the ICD-9 codes and all the CPT codes that you need at a click. So this is going to make navigation swift, easy, and accurate for everything you do. And right here you can see I'm just playing around with the different areas here. I can type in either the code numbers, or I can type in the first few letters of the problem that I'm looking for, and it all types it in there very well. And then just like I said before, all these templates can be saved, and they can be brought up in the instance, so you can repeat this over and over with a few minor changes. Even with examinations, as we all know, if we want to bill for an extended examination, we have to make sure we cover all the review of systems necessary. And we have a really neat way of doing that also with EHRiX, that we have a little chart that we can just bring up. And within a few clicks, click, 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 I can very easily cover my 7 review of systems, or 12 sometimes if I'm really going for an extended exam, meeting all the requirements that we all know that we have to do regarding billing requirements with insurance and so on. So that's really, 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 really neat.